I think one of the greatest opportunities for clinical decision support, or CDS, to impact patient care today is really riding on the wave of rapid exponential growth of health information technology, is what we heard Dr. Topol talk about this morning in the keynote. But that's just the technology platform, and even though we need that for clinical integration, you need a practice platform and sound clinical decision support to really also exponentially grow. And most people don't think about that. They think about the technology, but we need tools like evidence-based practice frameworks and care planning and content and order sets to make all of that come together. And so it is really becoming a heightened awareness that clinical decision support is key for patient outcomes and patient safety. Well, Elsevier is really approaching all of the opportunities and what's happening in healthcare today by having a comprehensive clinical solution, if you will, because we're not looking at it just from one aspect. We are looking at how to connect the care across the continuum with care continuity of evidence-based content all the way from the inpatient experience to ambulatory experience, and then how those things all connect. We also are working with interprofessional teams. We have interprofessional content that is developed, and we engage all of our clients in that process. So we're approaching it in that way. And then we're just adding more and more to our clinical solutions toolkit so that we can help work with our HIT vendor partners and our clients to help address their needs. Well, I am very excited about a lot of things. What I'm most excited about is the conversations are changing from 8-10 years ago when I came to HIMSS. There was heavy focus on just the systems and just the technology, and this year the conversations are, how can we look at care differently? How are we all going to meet the accountable care organization needs? How can we help our clinicians work together in teams and leverage the technology? So I get excited when the conversations start to change, because that means we, as a group of healthcare professionals, are going to see great change. So I'm very excited about that. And the other thing I'm excited about is there's so many clinicians here, and the sessions that involve clinical care, clinical clinicians have been full, and I'm very excited about that as well. We are including patients in our approach to clinical decision support in 3 different ways. The first way is our tools are designed in the electronic health record to be patient engaging. For example, part of evidence-based practice is knowing the patient's preferences, knowing the patient's story. So we're very intentional on engaging the patient and family in how clinicians care for them, and then that's documented in electronic health records everywhere, and it's continued across the continuum. The other way is Elsevier also has recently launched a patient advisory council, and through our consortium of hospitals, we actually have patients join the council to tell us what's important about transitions of care. What do you want us to be thinking about as a major clinical decision solutions group that is partnering with many to help improve patient outcomes? And the third way is we are developing a patient engagement strategy, and we are looking at how we can take all of our robust content, our methodologies, and actually be innovative and to create more of a shared decision making between the provider and the patient, and that can go a lot of different places. So we're very excited about that.
Yeah, for sure.